So this gentleman had a history of melanoma. As you can see, there's a scar on his back. It was done in a different place. We did also surgery on his abdomen. You can see here. And this biopsy was taken recently, so it shows melanoma in sight very early on. But the issue is, if you look carefully, when I wipe everything off, you can see there is pigmentation that goes around. So it's very, very difficult to tell how extensive the skin cancer, the melanoma is. You can see this pigmentation, it goes right around there and almost looks like age spots. And here's the middle where you can see the biopsy was done. So in order to avoid doing a very large surgery, which is probably unnecessary, what we're going to do is we're going to take what they call scouting biopsies. So we're sending our scouts, our testers around, and we're going to test this area in here. The white may be a regression because he says that nobody did a biopsy in that area in the middle here. There's a biopsy, you can see pink area right in here, and this is where the melanoma extension goes. And we can also use, as we've shown you before, Wood's lamp in order to better identify the edges. And here is the other area that we're going to take the biopsy on. So this will be piece A, and this will be here, piece B that we're going to take. So what right now we're doing is we're looking with a dermatoscope. This is a dermatoscope. Dermatoscope is basically a magnifying lens with some light, and we're looking on the pigment to see if it has any of the characteristics that are typically reported on the magnifying glass, the dermatoscope. So go in there.
Here we can see the blood vessel. There is the area of regression, and we can also appreciate three colors: darker brown, lighter brown, and skin color, which is the regression area.
All right, so I guess we'll take those areas there as well. What I'm going to do is just turn off the light for a second. If you can do the Wood's lamps, you can see the color, and that it looks like it's connected in a bridge, and it does go a little bit more. And this is another way of analyzing how far, the extent of it, because the color that's absorbed and the color that's reflected is different. The color that is reflected is the black, you can see over here, and that's why you see all the rest of the colors are absorbed. So that's why it accentuates this dark area with the blue light.